Good morning and welcome to the Landria Seminar Series 2025 Spring Semester. We're delighted today to have a great speaker with us today to talk about his research work. Dr. Samah Abdul Wahed, he received his PhD in organic chemistry from Marquette University. They are well known for their basketball. He completed postdoctoral research at Cornell University in Ithaca, New York, and also the Department of Chemistry at Texas A&M University in College Station. Dr. Abdul Wahed joined PDMU in 2018. His research interests include organic synthesis and impact areas such as medicinal chemistry, materials science, and reaction mechanisms. He is a prolific writer with over 30 publications in peer-reviewed journals and venues. According to Google Scholars, his work has been cited 1868 times last time we checked. I mean, I'm sure it's more than that right now. Dr. Abdul Wahed is an assistant professor of chemistry here in the Arts and Sciences, College of Arts and Sciences at A&M University. And he's going to talk about the design, synthesis, and antimicrobial evaluation of the new pyrimidine benzosulfamide compounds. I know this is a lot of what you call benzene and other organic chemistry. So with that, Dr. Abdul Wahed, the floor is yours. Welcome him, please.
Dr. Faris, for the introduction, and thank you everybody for coming today to listen to my talk. As Dr. Faris said, I have some kind of experience in biochemistry, biology. Basically, I'm synthetic organism. So the compounds which I have, basically it has some kind of benefits in biology or in material science. Like this is the material science, it was the thing which I was doing in my PhD. I decided to go back because my master degree of university, so I decided to do my postdoctoral in biology, and basically it's making some kind of intermediates to check the enzymatic. So today I'm going to give you also some kind of chemistry. I like chemistry, but I will give some kind of chemistry, also biology, but the biological part or the evaluation of the antimicrobial part. It was done overseas with my collaborator in Egypt. So as you can see, here is title. So I'm going to show you that I'm making some compound, and this compound has some kind of biological activity. So okay. So as you know, we are from chemistry, nothing ever would be here. This is our building over here. So well, the background of this, why we are doing this. So I believe most of you heard about the antimicrobial drug resistance. So basically, you can produce many drugs, but they are eventually bacteria can divide itself and make kind of resistance. And as you can see here, the number of these people. Okay,
We have a stick there. You go to additional.
yes. So as you can see over here, there are like 700,000 people die from this antimicrobial infection or bacterial infection every year, and this is going to really
go very high, like 10 millions by 20.
So, this is the background. This is the way in which we think, how can we use our tools to share our participate of making good lives.
So this is what we are going to design. So there are many ways to design drugs, as you know. To know what is how can you
Kill the bacteria because you know some kind of enzymes which you can inhibit for growth of the bacteria. So people use traditional actually, I mean, we use kind of traditional methods to design the antimicrobials.
it is based on our reading, also based on the what's called relation. So we think this is going to do something. We think this is going to do something, and so on. So we try to do this kind of balance, and probably we are. It's kind of fishing. You are putting a compound, and you see if it's going to be have any kind of activity or not.
So again, this is kind of a traditional way to do it. So we decided to make
About 25 compounds. So we decided to make 25 compounds, and based on changing of this part over here and this part over here. So basically, as you can see here, our object right now is to make 25 compounds in which you have you change here this benzene ring with, for example, 4-fluoro, 5 maybe 3 bromine, and so on. And you change this one to a different secondary element. So this is our object to make kind of a pool of compounds. So we have compounds, and we are going to see which one is going to be active. Okay, so this is next step, which is we are going to evaluate their antimicrobial activity. And also I'm going to show you what is the biophils inhibition, and we are going to talk about the pharmacology.
okay. So
This is a compound which we are going to target, which we are going to do. And this is a way for making this compound. So, well, you have a red part, which is here. We have a blue part, which is here. How can we do this? So basically, the first part over here, we call this Beginelli reaction, in which you are going to combine the ethyl cyanoacetate, which is this, with different aldehydes. Basically, we have 5 different aldehydes we choose, which is available also in our labs, and based on our reading, it might have some activities with the thiourea. So you put this together in a flask, and you are going to get this compound over here. So we call this compound is pyrimidine, okay, or thiopyrimidine. So this is the first part, which you can see over here. So the SH over here is going to be the source of the bag. This is the site which we are going to react. When I say reactivity, reactivity is chemical reactivity, okay, which is this part right now. And the other one, blue color over here, we use commercial available N-acetyl sulfonamide chloride. By first, you put here the amine. So amine has NH group, okay, NH. So it has H group, and you are going to do a simple reaction, putting the R group over here, and then you do a deprotection. Deprotection is going to make this amino group free, and now you are going to put the linker over here to put this with this over here. So you use here the chloroacetyl chloride, and you get this compound. You do a coupling reaction. Okay, so this is two reactions, and you are going to get this compound over here. So You are going to ask me why I have 25 compounds. Again, because we use different R groups here and different R groups here. So basically, you are going to see here, if I have R group here equal hydrogen, so we use this one and couple it with the ones which have different type groups over here. So total is going to be 25 compounds. So in this step, I did all my job for my graduate student. Like they have a very good job and we make all these compounds. The next step is collaboration with people, and actually I'm talking with you about this. Any kind of experience in work. So I did this with people overseas. So we have 25 compounds. We have 25 compounds. And we check this, the antimicrobial activity with this 25 compounds with gram-negative and gram-positive, as well as the fungal strain bacteria. You can see, this is the organisms which we used. And you do this with what's called the Zoom inhibition. So what is the inhibition? Basically, you have here a bacteria, which you are going to grow a bacteria, and you put your compound over here. So if the compound doesn't have any activity, so there is no zoom of inhibition over here. If the compound has very good activity, you are going to find here that this compound is going to kill all the bacteria in all this. So we apply this to every of what we have over here with this concentration. So we translate this to numbers and we look at all the numbers, and after this we pick up the compounds which has very, very good antimicrobial activity. So as you can see here, it's compound number 6, 19, 20, 25. We just give you a hint of how the structure of this thing is. So this is the compound number 6 over here, in which you have 4 bromo. It means we have here bromide group over here. And you have here diethylamine, in which you have diethylamine over here. So this is compound number 6. And you can also express what is the compound number 19, 20, and 25. So until now, I don't have a good answer for why this specific compound has some activity, but this is what we are going to do in our future work. So knowing this for the 4 compound is active, so the next step is to do some other extra work, which is evaluate or determine the MIC and MBC. So MIC again is the minimum concentration which can inhibit the bacteria to grow. Okay, and MBC is concentration, minimum concentration, which is going to kill the bacteria. So it means like we just give you kind of feelings of how this will different from the inhibition concentration of the minimum inhibitory concentration, in which we are going to put this concentration of the compound, which is going to inhibit the growth of the compound. But in case if you take some solution of this and put it in another tube, this bacteria can grow. And the MBC, so we have a concentration which is going to inhibit the bacteria or is going to kill the bacteria. So if you take some of this solution, you put it to grow bacteria, this is nothing because you kill the bacteria. So this is the difference between them. So the compound, which is bactericidal activity, it means it's going to kill the bacteria. And basically, there is some kind of equation to know if this compound is bactericidal or not. And this is going to be calculated by this relation over here. You put the MBC, over the MIC. If the concentration is less than or equal to 4, so it means this compound is bactericidal active. Okay, if it is higher than this, so well, it is not a bactericidal agent compound. Okay. So what we found here, and I'm going to show you the table. What we found here is compound number 6 and 19 is showing bactericidal activity against pneumonia and the artemisinin. Okay, the others, it is showing just for one strain, but for the pneumonia. So actually, this is the table which I have here. Well, the compound number 6 and 19, actually, it shows very good examples for bactericidal activity against gram bacteria. Okay,
I'm
so
sorry, I'm sorry to interrupt, I don't even, but, so you only list 2 here, but you listed a bunch of bacteria at the beginning. Did you only test these, the MIB and MBC on these 2 bacteria?
for the four compounds, for this 4 compounds.
Okay, so not for that whole list, so they may still have
No,
bactericidal
actually,
activity.
we didn't do for the whole list because, as I showed over here, we just choose the compounds which has a very, so out of these things, we just kind of filtration of looking at which one is going to have a very good inhibition, and based on this, we use this compound. After filtration of this 25 compounds, we found this 4 compound is going to have a more activity.
And then you just test it against those 2 particular bacteria.
Yes.
Okay, right,
So
thank
the
you.
zonal test determine which
Exactly.
product you're gonna go with.
That was a screening, so to speak, screening test.
Okay.
Yeah, I also noticed that a compound M6 has bromide, where compound 19 has fluoride. The difference between those 2 I think is which one is, I think fluoride is more inhibitory than bromide. I saw it, structure that you showed in the beginning.
Yeah. So this one has bromide,
Yeah,
and the one which has fluoride. So if we are talking about the most active, 6 and 19.
one has bromide, the other one has fluoride.
This one has bromide, this one has fluoride.
Okay.
Yes.
We'll let you continue.
Oh, okay, yeah.
Sorry
please-
about
please
that.
continue.
Yeah.
Oh, no, that's perfect. Okay. Should I?
Continue, and then at the end, let's let him.
Perfect. Okay.
We'll go back to.
Okay, great. Okay, so the next thing is to evaluate the biofilm. So to give you a kind of a feeling of biofilm, so this is a bacteria over here. Okay, this is cells. So the bacteria over here. So values categorize to 2 things, which is planktonic, in which the bacteria is behaved like single, and biofilm, in which they are coming together and they are making some kind of shield matrix to protect their cell. And the most important thing, which
Can you raise your voice a little bit, please?
sorry, yeah. So so basically, so for the biofilm, from the beginning, okay. So the biologist categorize the bacteria to 2 categories. One is planktonic, in which bacteria is behaved like single bacteria, and biofilm, in which they are going to aggregate together and make a kind of matrix. It is kind of polysaccharide film to protect the cell much higher. Okay, and basically, if you are going to apply antimicrobial or antibacterial agents, film the bacteria in the planktonic behavior single bacteria, have to apply like about 1,000 times more concentration to kill bacteria in the biofilm. Thing. And you can see this, and this is the matrix kind of slide layer. I believe you might be when you have some concept. But this happened like most of the people in lung disease with pneumonia. You are going to increase the concentrations of the bacteria. So because they are going to take a bite. So this is our next target to see what is the concentration which we can prevent this biofilm or the cell bacteria of the biofilm shape. So this is the result over here. So we did this for the 4th compound, again, the 4th compound, which we think it is more active, which is going to kill the bacteria in the first scene in the Zoom inhibition experiment. So, and by the way, they just use what's called tissue culture plate to do this kind of evaluation. So, as you can see here, this is the 4 compounds, 6, 19, 20, 25. And here is the MIC concentration. And when we have this 4% more, is going to do maybe, I'm not going to say it is 100%, but it is say more than 90% inhibition of making this biofilm. So again, this 4 compound show activity over here. Okay, so the last thing which they did is the pharmacokinetics. So when you make a compound, you need to see if it is the absorption of this compound is good. Your body to get rid of this compound, whatever expression you good. So basically, they use this kind of software, which is called data warrior software. So they put the compound structures. Software is going to identify this compound based on these factors over here: the lipophilicity, molarity, solubility, and all the stuff. And they are going to give you at the end kind of results, in which this is the pink area, which is here, which is going to show the bioavailability. Okay. And if your compound is going to be in this zone over here, so it means the bioavailability of this compound, or it could act as drug, is going to be much higher. So you can see here, it is around this big pink area. So it seems like the compound could work as drug like compound. Okay, so for the future work in this work is, again, I showed you some compounds, but I told you I don't know exactly why they are active. So most of the compounds, or most of the antibiotics, the targets DNA synthase. So this is what we expect also for these compounds. And we might look in very detail about kind of docking compounds, what is the enzymes which especially going to work and inhibit. And also, besides this, we do this, we can also expect more compounds, which is going to be more active. So to make it short, like we have 4 pro and 4 no, why they are active, what is the enzyme which they are going for, but going to do this kind of to see the active site and how is this compound fit over there, what kind of more rules that we are going to add or move to make it more fit to that. And also, this is going to lead us to another thing is to maybe make more compounds, okay, based on. Okay, so this is the conclusion. Again, we make compounds. We have again this kind of fishing, like to make kind of compounds. We put it there and see which one is going to be active. We are likely to see at least two of them is very active and and yeah. So again, this work, many people work with this one. So in our chemistry department, it's my student, he graduated and now he is a PhD student and Texas A&M. He made all the five compounds. And this is my collaborator overseas in Egypt. They do the antimicrobial activity and also overseas also they do the pharmacokinetic method. Actually, this work we published last year at the end of the last year, and yeah. Well, thank you very much, and thank you for listening.
Well, we have plenty of time to ask questions. So thank you for this great presentation. And we take the first question from here.
Thank you, Dr. Abdul Wahab, for the presentation. Well, I'm a chemical engineer, so I may have a lot of questions, but I will keep it short for everyone to get an opportunity to ask a question. So if you can go back to your slide where you are showing the synthesis of M15, I am wondering where is this triple bond coming in picture?
From
Yeah,
what?
yeah, the M15 molecule where it is forming. Yeah, right there.
Is this one?
Yeah, where is that? See, initially,
Is this middle one?
yeah, this
This is cyano group.
Okay,
So cyano group is C triple bond N.
okay.
Yeah, I just write it down like this one because it's kind of yeah. You can just write down here SN. So here is carbon, and this is triple bond N. So it is SN.
So where is the 4 F or 4B? Where is the functional group there?
You mean this one?
That's the one.
So okay, let's put this here. So R1 here could equal hydrogen, and R2 is equal this diethylamine over here. So this is compound number 1. Compound number 2, you have hydrogen, but you have the pyrazine, piperazine, morphine, and thymorphine. So basically, you are going to have 5 compounds in which you have R1 here is H. You are going to repeat the same thing with 4 bromo. They are going to do the same thing with 4 chloro. So basically, 5 multiply 5 equal 25.
It's different combinations.
Yeah,
Okay,
exactly.
so different combination, you have 3 items that
We have 5 and 5. So total is going to be
combination, okay.
Well, the next question is, say you are using this compound. What about, so when you apply this, say on a surface or you are using it for some application, what about the residues which are remaining after the disinfection? Are there any residual compounds which will remain there after the disinfection happens?
So we use this compound, for example. Your question is what is the fate of this compound?
Yes, after the disinfection is done, when the application is.
Yeah, actually we didn't know what the
Okay.
fate of this
But
compound.
there are chances that you may get something there. Now, I have a question. Say you tested different microbes.
Right.
Now, in industry where I worked, we have a consortium of different microorganisms.
Okay.
So especially I work in algae. So in algae, what we get is a lot of bacterial contamination. So with compounds like this, is there any chance that I can selectively disinfect some of this bacteria, it can be gram-negative, gram-positive, because I want my algae to grow and not all other compounds. So can you do something? Can you guide us whether any compounds like this can be used in that application? And the other question that I have is, say, this MIC you said 375, right? Maybe on the higher side. But if you really use a technique like, say, for example, electrostatic application, or if you pass this compound through electrical effect, will this MIC come down?
Okay, so let's answer your first question. For allergy, I don't know if this is going to work. Okay. Like even very small difference in command, and be active. Even isomers, I think I use one isomer which is the same structure, some other thing, it's totally not. I'm not sure if with the, with it will work. But I mean, it is a kind of experiment which you do and see if it's going to work.
I think this is a really good study, and we will discuss more. Thank you
Sure,
very
yeah,
much for being here. Thank you.
I think that you said it's good. There is a room for follow-up with this work, and I think collaborating on this. We have 3 questions here. I think we'll start with an economist asking a question about microbiology. So this is interesting.
So, yeah, this looks like a great work. So I have basic questions. So what would be this, like this chemical, this compound? Is it substitute for antibiotics, or is it like cleaning agent like other chemicals? How do you use this? Do you eat it, or do you like, scrub something?
You talk about the 25 compound which we.
Yeah, the compounds you're talking about.
Yeah, so
What is the application of this? How do you use it?
so, well, this is, to be honest, this is kind of academic work in which you make the experiment and you apply this. If somebody will interested about doing anything after this, sure, we can expand our work. Yeah.
So for now, we don't know.
We're trying to commercialize it already. We're already.
No, I was confused, like, if it is like, used as cleaning agent, right?
Yeah.
I mean, why this and why not already existing like chemicals that we have Clorox?
Yes, so basically, drug industry, they have their own facility, their own machines, make even better than. We are very limited here, right? And we cannot compete with. So they trust their lab research over there. And yes, is there, I talk about this one, I present this one in a national conference. Maybe somebody will be interested to check further, maybe not. Yeah.
The reason I'm asking this question is because you mentioned antibiotic resistant, like, and then that is, going to create a big, public health concern. Like tens of millions of people might die because of that. So what is this chemical's position like in the future, potential position in that? You already mentioned that.
Yeah, I don't know the answer.
Yeah. Maybe this is for all of us.
It is. I think it's, I think what he's asking are great questions, because I think knowing the mode of action, how does this chemical inhibit this bacteria, etc., would be helpful in understanding, as you mentioned, microbial resistance, and then maybe you can design a drug that will basically avoid that type of fate and so on. So I think there is a lot of, yes, these basic academic important, because they lay the ground for more advanced work to be done. So I think it's,
we ourselves, we need to know why is this command.
yes.
But
Definitely interesting. I just want to see some like, commercial or like, like, let's say.
I will happy to,
Pub-
I will
public
happy to collaborate with you and you can just market it.
Right.
He's an economist, so he understands the practical question about, thank you. I'm impressed about an economist asking a question about microbiology. That's great. Dr. Assisi.
Thank you so much. It's a very excellent presentation. Maybe just to add on what you said, finally, we do mechanism, we try to do those kind of study in our group. You had, in our group, with Dr. Katzer, we used to talk to you. So we try to understand the mechanism behind or the mode of actions of the any program that we think has antimicrobial, anti-cancer, and antioxidant property in our lab. So you can collaborate with us.
Yeah, perfect. I think also Mariam
Yeah.
is kind of,
Connection
with
with the student, yeah. Also, I think he was a supervisor, so we do the same kind of activity.
this will be better because instead of waiting long time for us to finish this and send it to our seat and waiting them to give us the answer, at least like. So I would be happy to have any kind of information.
Just coming to some of the comments or questions I have. Into a zone of inhibition analysis, I don't know how you select the concentration at the beginning, as far as you don't have any antibiotic as a control that from that
We don't
experiment.
have control. The idea is to just see which one is going to have this activity so we can proceed to the next.
Yeah, if you have the control, it can give us an idea whether that product can serve as an antibiotic.
Yeah, I agree.
So considering the standard is very important. And also about the MIS and the MBC, in most instances, the biofilm experiment based on just by doubling or taking 4 times of the MIC.
Yeah.
Why don't you just fetch at least the MBC there? Because in most instances, MBC is larger than the MIC.
Right.
So the MBC will be your cutoff to determine how much concentration you can make.
Yeah, I believe they did this to see what is,
Yeah.
I think they did this to see what is the ratio between the, MBC and but I agree with you.
Yeah, because I'm thinking on the clinical application for medical application. So the NBC is the cutoff that can stop you not to move more than the X times of MIs.
Right.
That's like the right. Then in some research they show that if you had an idea of you have the information on the ratio of MBC versus MIC, it gives you at least the mechanism. If the bacteriostatic, it maybe has an effect on the cell wall or lipopolysaccharide, so it gives you an idea at least.
That's perfect. Actually, if you know how can you do this, I can give you the compounds and we can.
That's
There you go.
Yeah.
I'll be quick. I'm a food microbiologist, so I'm interested in the other end, and I realize it's not commercializable, right? But do you do the zone of inhibition work yourself here in chemistry?
No, as I said, we did the chemistry compound, but making the compound. But we send all these compounds overseas, checks by.
I'm very interested in following up. We're just starting to do some antimicrobial resistance in fish and seafood with one of our students. So very interested in following up. Really great seminar. Thanks.
If like I have many antimicrobial drugs that I had for this 6 years. I like these things. We can do any kind of work with it.
Great.
It's a nice presentation, and I think it's continuous from Dr. Adis's question. It's about inhibition zone, and did you you measured the inhibition zone, yes, and did you determine what size of that inhibition zone in millimeter, which we consider as resistance and sensitive and then intermediate.
Okay, again, I didn't do the apology form, so so basically the integration is what you did first was, which is the most active bonds that I have. It's really associated with the next. But more than this, I don't think we did anything. Otherwise, we would to have any further work. What I believe is you just make a kind of quick scheme. See the most active. I'm not sure that my answer is
This is worth a more in-person discussion. I think that's a good idea. If I understood you right, is like the diameter would be one of the parameters. I think it's a good idea to look at it. Because if the parameter is small, that means maybe the active, you can maybe correlate that with the level of activity. I mean, the efficiency in controlling the bacteria.
Yeah, because depends, sometimes different bacteria, they may have different kind of inhibition zone, which actually, when we go to the doctor, they do the test, antibiotic sensitivity test.
Right.
And then on the list, give you for different kind of bacteria, and then they write the resistance, sensitive, intermediate. So what did they consider that is resistance? What is that inhibition zone in millimeter? They have for different bacteria, they have different whatever they call it, resistance and then
Right.
sensitive. So
Thresholds.
yeah, there's some kind of threshold. So yeah, I just want to know if you did with this.
Maybe it's worth taking a look at it. We have a question from a student. So encourage the rest of the students to ask questions. Don't worry. I mean, if economists can ask questions, I think you can, right?
The economics is the base of everything, so he can ask.
Thank you, Dr. for your nice presentation. It was interesting. I have a couple of questions regarding the synthesis. If these compounds are, if they have potent activity, then it will be the critical, the case of clinical trials. Yeah, if they have potent activity, the next step will be the clinical trial.
Yeah.
Yeah. So, if that is approved, then the next step will be upscaling and
Yeah,
commercialization.
usually there is kind of phases.
Yeah.
The combines.
Yeah.
Both.
Yes, it will be upscaling and commercialization. So, how do you justify the use of compound? How is the yield? How is the yield?
Oh, okay. I think I showed it over here. So yeah, for example, this is about 80 to 85% yield. So it is more than like 80%. So yield is very good.
Okay, how about the byproduct in terms of cost? Is that effective, the byproduct? The byproduct,
Yeah. Of course.
is that effective in terms of cost?
Cost.
So,
Money.
do you know, do you mean by product, like I have a product and
Then
byproduct?
byproduct, yeah.
So actually, we didn't actually.
Is that affordable to upscale? Yeah.
That's a chemical engineering question. That's a good question.
Mariam, just to make sure I understand you. So when you make a compound, there is a very little byproduct besides the product here. You are asking about the byproduct?
No.
Or you are asking about the
Just,
product?
when you buy the starting material,
When I buy the starting material,
Yeah.
okay?
then you produce something, yeah?
Exactly.
After that, the byproduct will be left. Is that compatible to what you just?
Oh,
is-
No, you don't look at the
How cheap or expensive will be
It's
the
not like
material?
the fact that he's not commercializing
Yes.
it yet. I think we're trying to get him to make a product.
You know, at least, let me make it very clear. You see the size, you may end up with a powder, yeah?
Sure.
You may end up with a powder, whatever, the powder form I'm expecting, it could be a powder.
Okay.
Then, if your starting material is more expensive and you, in the product is small, there will be a need of scaling up the cost and all those things she's asking. How it's feasible? How it's feasible in terms of scaling up this?
Oh, it's also,
Considering, yeah,
there is no problem with scaling up.
So if you are going to replace an existing antibiotic, which is being used currently,
Okay.
is it, do you think
So,
it's
so it
feasible?
it seems like compare between the cost of making this one and the cost of the other
Yeah.
already made antibiotic.
Yeah.
Well, I believe this kind of stuff is very cheap. This kind of stuff is very cheap. So I don't think we can find a cheapest method to do this.
But I think it's that, can you? That's a little bit too early for that. I think there is the economy of scale. This is the tube level, this is at the lab level. This is not at the pilot level, this is not at the demonstration level. So there are, I mean, economics of those are really depends on which scale we're talking about. Here, is there a functionality? Is there some product that has promotion that, I mean, potential of being, can kill bacteria, or that's what we are at the level. So those levels, we'll talk about them at a different stage, but it's a good question to have. And I think that means that people are here entrepreneurial. They think about doing a business, establishing a startup or something, which is great. I think that's what we, and it's coming from our student. That means, yes, we have to have the right thinking about how to scale up, how to make business, how to make a startup.
But I agree, sometimes when you do a reaction, low scale, it's go very easy, no problem. And when you make a large scale, you might have some difficulties.
Yeah.
I agree with you.
Then it's another issue. It's another production issue rather than to be if that product viable or not. Okay, you have another question? Sure.
When I see the reaction condition, it looks conventional ones.
Or you see the reaction to,
Yeah, it looks conventional reaction.
okay.
You use it like that. Did you try the green synthesis?
Oh, the green sense. Well, this is,
Thank you.
I can say this is the most happening moment. Like, we are not using any cancer around any, and basically when we order anything, we check with the safety feature.
I mean, like the ultrasonic mediated reaction, like microwave ultrasonic.
So, you mean making the reaction, green reaction without also? No, we did.
Ultrasonication is one method of stirring it. So green, what she is
Well,
referring
means
maybe
it
to
turns-
is
it
green
implies
solvent.
in a-
Yeah, well, to be honest, we are trying to use the picture, methods for making the compounds. We didn't try to do it something water, but because most of this compound is non-polar compound. So you have to use non-polar salt. And all this is organic. Right? But anyway,
You cannot call them green solvents, right?
yeah.
They are not green solvents.
Yeah, they don't like this, like for example, you know how they do the decaf tea and decaf coffee? You know how they do it? Huh? So basically, they have the coffee or the
Extraction.
and they do extraction with acetone.
Correct.
So they put this in acetone. They put this tea in acetone and they stir it. And acetone is going to take the caffeine. And so even this, you can do even in like So people, yes, they say we like green chemistry, but
Well, that's a great way of thinking. What she's saying is really important, sure, because green methods, they are the methods for future.
Okay, we have one more question here.
Yeah, I just came back with, from curiosity, why you use halogen chain compound?
so, we know the halogen here has some kind of, antimicrobial activity. So that's why we try to put halogen over here, different halogen like bromide or chloride or fluoride. Also in different position, like in 4 position and 3 position, and something like this. So why we use halogen? Because we know from literature it has kind of antimicrobial activity. Well, maybe it's why. Yeah, and basically, again, I'm not sure why bromide work, but fluoride is not working. You know what I mean? So again, this part is going to be in our future actually work. See how this works. What this specifically, what is the enzyme which is going to work in bacteria and there's anything. What is the active site? How this will fit over there? What is the connection between the halogen and the active site?
Yeah, I just asked because I was thinking about potential antibiotic drug development from this product. But I'm thinking that most of the existing antibiotics, none of them have halogens. But in contrast, when you compare those germicides that we use to clean up things, they are rich in the germicide. I mean the halogens.
Okay. Maybe I didn't understand this. You said all the antibiotics.
The existing antibiotics currently on market, they don't have halogen chains origin from there. But if you see those germicides that we use to clean up things at home, they are rich in the halogens. So I'm thinking how we can potentially use the product with halogens and antibiotics.
Okay. Yeah.
So he's saying human application versus industry applications.
Yeah.
Because halogen, what he's saying, it may not be appropriate for the human applications. That's what you mean, right? For human applications.
Yeah, for
halogen
antibiotics,
may not be
yeah.
appropriate.
I'm just thinking that.
So we are talking about halogen in general, like chlorine, bromine, also.
Yeah, those
Or
what you
you
use.
are talking about the compound itself, because the property of, like example, they both chlorine in the swimming pool, right?
Yeah.
But we are not using halogen. We are not putting we are not. It is a compound which is completely makes the compound different, right?
Well, this is a great discussion. I think you have a lot to follow up with potential collaborators. Thank you. I guess it's good to have a relatively shorter presentation that allow discussions. I think it depends on the topic as well. But we're very well. Thank you for this time, and thank you for the discussion opportunity to collaborate with others.
Thank you very much, Dr. Faris. This is actually the 3rd time I gave a presentation. One was in the time of the COVID.
Yes.
And the other one was the other place. Yeah, and I will be happy also to come next year with the next project.
Yes. And for his credential, I called him last week and on Friday, I said, will you be able to present on Thursday? He said, sure. I mean, you don't get that answer very quickly, right? People will just.
If you need me next week, I can
Let's thank him for his time. And if you want to have a picture with him, I mean, our professional.
The first slide, if you can come on to the first slide.
Yeah, we'll have a picture. Yeah, okay, I don't park here.
Oh, you did, yeah, I had to walk all the way
I don't
around.
have, I don't park here, I park.
Oh,
I park here.
yeah, they closed that whole lot off, I had
Yeah.
to walk around here.
I don't remember he sent a message, but I think he did only for cars.
Oh, okay. Yeah, that one, I had to get over through it.
Yeah,
All right.
please come take a picture with our presenter this week. Professor Anu, come in, please, take a picture.
To do the qualitative work.
Yeah. Yes. Say no. You move a little bit further, because you don't want to have a hat on your head. Your picture will be weird.
Yeah. You can come in front of me and I can.
Gotcha. All right, I got everybody ready. 1, 2, 3. Got it.
Thank you.
Thank you.